This was notable. On Sunday, before the Broncos game with the Chargers, their head coach Jim Harbaugh briefly left the sidelines. He went into the blue tent. You don't see the coaches go in very often, right? Well, afterwards, the 60-year-old told reporters that it was for a heart arrhythmia, an atrial flutter, something he said he's experienced twice before. He knew right away something was up.
I know a lot about it, so I just wanted to see what the pulse. I'm not good at taking my own pulse, so just took the pulse and it was in the arrhythmia. So, but I felt like we were good, and then they just said, no, we need to get an EKG. So trust the doctors. You know, if you're not going to trust your doctors, who are you going to trust?
So he said they were comfortable. They got his pulse. Joining our discussion now is a cardiologist, our 9 News medical expert, Dr. Kohli. So atrial flutter, arrhythmia, ablations, a lot of these words that we're learning about this week, talking about Jim Harbaugh. Can you kind of run them down for us a little bit?
Yeah, so the atria is the top chamber of the heart. That's where the electricity normally comes from. When you have an atrial flutter, you have an electrical short circuit in that top chamber of the heart. So normally our heart beats about 70, 75 beats per minute. This is going twice as fast. So the electricity kind of short circuits itself, tells the bottom chamber to follow the top chamber, so your heart rate suddenly jumps up to 150 beats per minute.
You feel it.
You feel it. Most people can tell the second they go in and the second they go out. Now, there's some people who've had it for a long time. They start to get numb because the nerves can change around the heart and they don't feel it as much. But in his case, it sounds like he knew when he went in. You feel your pulse is racing and you know you're in.
That's mean your arrhythmia. So your heart is out of rhythm at this point.
Exactly.
Your heart is just beating wildly.
Yep, and what can cause it? I mean, stress can cause it, dehydration can cause it, alcohol. We see it often post-operatively. We know that President Biden has atrial fibrillation, which is a cousin of atrial flutter that happened after his gallbladder surgery. So it's not unexpected for someone who's 60 years old to have this. And it can be in the presence of structural heart disease, so you can have a condition like heart failure or something going with it, or it can just be isolated by itself. Your heart looks normal, but that electricity is still misbehaving.
So he was at a high altitude too. That's the other thing when you talk about all of this. But so they went in, do the EKG. I mean, It seemed like he came right back out.
Yeah. So they made the electrical map. That's how they diagnosed it. You feel your pulse, you take an EKG, you know that it's atrial flutter. You can try some maneuver sometimes, like pushing on the nerves in your neck. That's called a vagal maneuver. That can release chemicals that break it. But most of the times, if you get an IV and get something in the IV, a medicine called a beta blocker, that can kind of help the electricity to chill out a little bit and break. Once in a rare while, if you're unstable, meaning because your heart is racing so fast, your blood pressure is dropping, or you're short of breath or dizzy or lightheaded, they'll actually shock you out of it, just kind of reset your heart.
And
back.
since this wasn't the first time and he's really familiar with it, then you're guessing then he's probably, this is something a cardiologist is caring for him and looking at medications and other things?
For sure. So if he's had 2 ablations, and an ablation, Tom mentioned, is a procedure they go in from the groin and they zap that little electrical short circuit. They almost kind of cut the wire so it doesn't keep causing it. Now that fixes it, but some people will recur after an ablation, either because it was incomplete or because the scar tissue that they create with the catheters, with the zapping, that actually causes another electrical problem, so you can get related arrhythmias. So medicine's usually is the mainstay for someone who's had recurrent aflutter episodes. One medicine to thin your blood, because when that top chamber is racing, it's almost like jello. The heart is jiggling, it's not squeezing. So the blood is pooling inside. You can get blood clots that cause strokes. And the second to slow down the heart, usually a beta blocker, but sometimes a medicine called a calcium channel blocker.
Yeah, he also, they referred to him being given magnesium and also now wearing a heart monitor, of course. That's collecting data. They're not worried about him having another event or a larger event. They just want to see and hear his heart on a regular basis.
So the magnesium chills out the electricity, just like the beta blocker. The heart monitor can monitor how much more he's having, because this is now going to guide our treatment. Now you're talking about someone who's had recurrent aflutters after ablation. So me as a cardiologist, I want to know what his burden is. How much is he having? How fast is his heart going when he's in it? How long do those episodes last? Because that will help me determine now, next, am I reaching for a daily medicine called an antiarrhythmic, like a stronger medicine to chill out the electricity? Am I going to send him in for another ablation?
He had a good day. They won the game. But would you have been comfortable saying, well, let's go ahead and
go
coach?
back out.
You're back normal now. I mean, you haven't been treating him for years, but I mean, someone who's maybe been treating him for years says, you know, you're fine.
So if it was literally like 30 seconds or a minute, you might say, okay, someone's had it before, they're feeling fine. After this kind of an episode, you feel fatigued. Your heart just ran a marathon. It's ran at 150 beats a minute. Ooh. So most of the time, you don't want to go back and get that stimulus again, that stress hormones, the game, you don't want to do that.
There's
you want to relax a little bit until you get on the right medicines and the heart's in a happier place. Getting your electrolytes checked, checking your thyroid, these are all things he should have done as well. Getting an IV fluid bolus to make sure he's not dehydrated.
All right. Well, thanks for the info. Good to know.
And we'll tell him how to get a hold of you, too, if this happens again in the next game.
He'll be back next year.
You can find more from Dr. Kohli at 9news.com/Dr. Kohli.